So I thought I'll bring all of this together by telling you how IJO has been involved in bringing some of these innovations to its readership. 3. Okay, so very quickly, why the IGO? Because it is open access, it is indexed in PubMed and many other indices. It has a very wide reach. It has quick review process and decisions now with Dr. Honavar's term. It is of course pro-Indian. It accepts a lot of variety of different articles like devices, techniques, etc., where your innovations actually can fall into. It is a dynamic, you have a dynamic and encouraging editor who is right here with us, and the journal recognizes the need to bring out and archive the best in Indian ophthalmology. Excuse me, next slide. It's not happening. Yeah. So this was an editorial which was published in 2019, which talks about innovations in ophthalmology and the potential power of frugal innovations. The editorial board of the Indian Journal of Ophthalmology recognizes the need to highlight native innovations and find space for them in the academic literature. And we have initiated a new section called Innovations in Ophthalmology. And we look forward to a good, flood of good publications in this section. This is exactly what our editor, wants to send the message out to everyone. So these are some of the examples which have been published since January 2018. I'll show you several of these. We won't go into the details. So this was in January 2018, so which talked about use and validation of mirrorless digital single light reflex camera for recording of vitreoretinal surgeries in high definition. Then this was published in August of 2018, which talked about using of chandelier assisted retroillumination for phacoemulsification in phaco-vitrectomy, a rather sort of difficult situation. If you look at the top left image, you really don't have a red glow. Then newer devices which are coming in, and then you want to actually validate them, you want to publish your results. So this was some of the initial work on Zeptorexis, which was published in September of 2018. This was quite an innovative technique which was published in November 2018, which talks about smartphone based evaluation of the optic nerve head. Then there have been a host of publications on artificial intelligence, which there is a guest editorial, there's a review article, and now recently there is an original article all on artificial intelligence. Then there are very small sort of innovations, which this is a use of a wire lid retractor as a new use of a new use of a wire eye speculum. So you can actually evert the lid using that innovation. Then this is again published recently in May 2019, which talks about trash to treasure RedCam. So what these authors are using is all the trash which you generate in your OR, and then trying to make a retinal imaging device with that. Then of course this is something that we all know about, is the MI RedCam assisted smartphone based fundus imaging for retinopathy of prematurity. It was published in June 2019. This is again a smartphone guided wide field imaging unit for ROP, which is a do-it-yourself sort of version, again in June 2019. And this was right from the horse's mouth. So this is the simple limbal epithelial transplantation, or SLET, which was pioneered by this group, and they have actually put all of their findings together. So this is pretty much everything there is to know about SLET from the innovators themselves. Then there was a recent editorial in September 2017 on external ophthalmic videography with different tools and techniques. Very interesting. You should read it if you haven't. In the same edition, there was in the same volume issue, there was another on flexible tripod mounted video camera, an economical and effective method to record oculoplastic surgeries. So these are all innovations. I've shown you about 8 or 9. Some of them have also been rejected. But what IGO is looking to do is to highlight your innovations and bring it to the fore. Very important is to do it well, write it well, and the material, it's sometimes not only important to be very innovative, but also important to the way you present it. So we are looking for highlighting your innovations, provided they are done well. So I hope that with all of these, you will choose IGO as your journal of choice to bring your innovations into the real world. Thank you very much.
Thank you, and we have exactly 2.5 minutes. Santosh, we would like to have your comments on the session and also the way forward.
It's wonderful. Everybody did a great job. I think some of you are ignited with all these nice talks. Thank you so much. Thanks for being here.
Any questions from the audience? We have 2 minutes. Any questions? Everybody's awake, sleeping? No, they're people. Okay, so if you have no more ideas, I'm sure that everybody who's spoken today is approachable. Their emails and contacts are available, so you can always have discussion over tea and coffee, which is always better. Anything can happen over that. Okay, thank you.